Thank you for tuning into Halton News tonight. It's Friday, April 24th, and I'm Jessica Kading. There are 4 more people in Halton who have confirmed positive for COVID-19 since yesterday, bringing our total to 415 confirmed and 55 probable cases for a total of 470. Unfortunately, there's also an additional death to report. 19 Halton residents have succumbed to the virus, and 10 of those deaths were a result of an outbreak at Mountainview Retirement Home in Georgetown, where 63 people have tested positive. Melissa Candelaria spoke with Halton Hills Mayor Bonnette this morning about the tragic news.
This week, first of all, last week on Saturday, we finally got numbers from the Regional Medical Officer of Health. If you recall, last week I spoke about an outbreak in one of our long-term care facilities and retirement residents on Mountain View, and the Medical Officer of Health had to get clarification from the province due to privacy, and unfortunately it wasn't good news. We had an outbreak at the Mountain View residence, and the numbers were 63 residents and 18 staff contacted the COVID-19 virus. And unfortunately, we had 9 deaths. I believe they were all residents. So that is now released, it's public, and that's one of the reasons why Halton Hills, we were all wondering, why are the numbers higher than, almost the same as Oakville is, which is a much larger population. So it's very unfortunate, and our hearts go out to the families and loved ones that are impacted by the deaths. And we want a speedy recovery for all those other people that are suffering from it. But it seems to be a case that's gone throughout the province in a lot of long-term care facilities.
Let's talk about that a little bit more. So now that you have those numbers, what is it that you and council are trying to do to, I guess, alleviate that situation? Is there something that you can do?
Not particularly, because the health department is handled by Halton Region. So they've been working very closely with the long-term care residents, along with their local hospital. I spoke to the local hospital earlier in the week, and they assured me that they are working with the long-term care residents. But what I can tell you is that we have about 24, I believe, senior residents, long-term care in the town of Halton Hills. Like when I say senior residents, just entitled, just purely senior residents, not on any sort of provincial plan or anything like that. And we've only had 2 outbreaks out of the 24. And the other thing is Dr. Anita Anand, myself, and a few others, we've collected a community PPE drive, if you will. And it's been really, it's unbelievable. We've had nail salons, dentists donating their masks, donating their gloves. We've had over 90 families sewing gowns, caps, etc. And now Superior Glove, they retooled and they made over thousands of gloves that they donated. That's going to the hospitals, going to local doctors. And now, just yesterday, I received the first 160 shields that that's very important. That's also going to be distributed around. And these are going to some going to long-term care facilities, local family doctors, midwives. They're going to pharmacies, as well as to the hospitals. So the community's really been stepping up big time in local industry.
Just like our other municipalities, Halton Hills is also dealing with a littering issue of personal protective equipment like masks and gloves. Mayor Bonnette also talked about the steps they are taking to encourage residents to stop.
I know the pollution you're talking about, more and more people are wearing masks, wearing gloves when they go shopping, etc. And unfortunately, and it's hard to believe, I have to remind people that this isn't very sanitary. I mean, this should be common sense, but we've had concerns in our parks on just discarding their gloves and masks, and there's countless stories everywhere, just not in Halton Hills, about grocery stores where people are discarding their gloves in the carts, and they're discarding them in the parking lots. Well, we have a bylaw in place that you can get a $200 fine if you get caught doing this. So we did a press release, and we want the public to be aware, and we're going to be enforcing this. There won't be any second questions like, oh, gee, I didn't know. No, people, you know better than that. It's littering to begin with, but it's unsanitary. And even if you see somebody, you don't have to confront them. Just take a picture of their license plate number, and we'll follow it up. So that's one thing that we can follow. Plus, if you see the driver. But we want to take this one serious because this is a health hazard.
Despite the littering, there are still many in need of personal protective equipment in Halton. I spoke with Oakville MP Anita Anand, who's also the Federal Minister of Public Services and Procurement, for more on acquiring PPEs locally.
Most definitely. We have had people reach out in need of personal protective equipment, and this is so important to be able, as a member of parliament, to address local needs. I'm in an interesting position because federally my role is to procure for the provinces and territories. I'm so concerned about the needs in our own community. And so I have reached out to the Oakville Trafalgar Memorial Hospital. I've also reached out to individuals and volunteer organizations to see if they might have personal protective equipment for those in need. And so it's a constant communication that I am engaged with at the local level to make sure that we have what we need. We have a number of volunteers stepping up in our community. We had an organization, PPE to the Ian Wallace House. We also had PPE being delivered by a group here in Halton, organized school system. So people are really all hands on deck. It is very heartening to see. And one thing I love about Oakville and Halton is that there are really, really dedicated people, community volunteers here seek to serve, and it's a real privilege being the member of parliament for this area.
Ramadan has begun, and normally the Muslim community across Halton would get together to celebrate. But with the physical distancing restrictions in place, one organization had to get creative. Melissa Candelaria spoke with a representative from the Milton chapter earlier this afternoon to talk about how they are going virtual this year. Let's take a look.
In light of COVID-19 pandemic, the Ahmadiyya Muslim Jamaat Canada, we've launched this special national campaign called Virtual Ramadan. So basically, the Virtual Ramadan campaign was organized to give all Canadians a unique opportunity to, experience Ramadan while still conforming, of course, to the social and physical distancing guidelines that have been set by the authorities. So we've created this website called virtualramadan.ca, where people can learn more about what's happening with Muslims across Canada as we are self-isolating, but also an opportunity for people to join in tomorrow, being Saturday the 25th. We're going to have Canada's largest, we believe Canada's largest gathering of Muslims virtually. It starts at 4 p.m. Everyone's invited to join, listen in, and there'll be different speakers, including Mayor John Tory, who's going to be on live, and we'll have special guest appearances, I think, with recorded messages from most likely the Prime Minister and other premiers and mayors across the country. Everything that we talk about or focus on more in Ramadan, it's kind of funny. It relates to how all of the world is actually now behaving in terms of being self-isolated, more time on our hands. And I think you'll agree with me, Melissa, there's a lot more people turning to call it what you want, prayer, meditation, but connecting with your source. And we're inviting all Canadians to come and join us, regardless of if you have faith in a God or for atheist or whatever. Just come out and join. And it's good to connect that way. We think we all kind of crave that human connection, and this is the way we do it. Our imams are delivering their sermons virtually and guiding people and helping them and assisting them, and we find that that's really helpful.
Recent numbers in the Halton area suggest that the curve for COVID-19 has peaked and is starting to decline. In an episode of Burlington Matters that will premiere tonight, Mayor Marianne Meed asks Dr. Dale Kalina, Medical Director of Infection, Prevention and Control at Joseph Brant Hospital, exactly what that means.
I want to talk about the numbers that we've seen recently, not only province-wide, but in Burlington, that we had some fairly good news earlier this week around the idea that we may have hit the peak, and it was nowhere near what we thought or expected, which is good news. The measures that we are taking collectively as government and as individual residents and as healthcare providers seems to be slowing the spread. It's still spreading. I think that's an important message to reiterate, that we haven't stopped this thing. But what does that peak mean for healthcare? Are we expecting a second surge? What can you tell us about, are we going to start to see cases declining? Doctor, what does it all mean to have that peak?
Yeah, I think you've asked a number of very good questions, and you're very right to say we did and have been starting to get more and more good news, especially over the course of this week. And you're right to say that the Chief Medical Officer of Health for Ontario announced earlier this week that we were likely seeing the peak right now. Now that's based on, yes, a lot of models and everything that we've been seeing over the course of the past several months, and also the rate of increase of the new cases that we're seeing every day. Now, when we're talking about that peak, the peak that the Medical Officer of Health was referring to was the maximum number of daily new cases that we're seeing. So it's important to recognize that although the peak may be right now, in the days to come, we're still going to be seeing quite a lot of new patients every day. And although that number of new patients is on the decrease, it's still a lot of new patients. So as an example, yesterday rather, we've been seeing around 500, a little bit in excess of 500 new patients a day. And that would mean that in the days to come, as we start to go back down to numbers in the 400s, for instance, that's good news, but it's still 400 new patients every day across the province that we're seeing and are here to take care of. So although we're seeing that peak of new patients every day, the other peak, our peak surge capacity or our peak surge of patients, is another thing that we as hospitals and healthcare providers look at as well. Because the number of new patients, while remaining high, they need that care, and we need to be able to provide that capacity. So as Eric mentioned about expanding our capacity at the hospital and with the PRU, that's exactly what we prepare for, is that peak surge. So that peak of patients that we need to care for. Now, the second part of your question, so here in Halton region, it looks, based on some of the data, that we may have in fact peaked last week, which is, again, great news. It means that the number of new cases that we're seeing every day is getting to be lesser and lesser. I believe over the course of the past 72 hours or so, the number of new cases that we've been seeing is actually in the single digits, which is excellent news. It means that as of the 19th, which is the latest data that we have available via Public Health Halton, it means that in Burlington, we've actually only had 86 cases, which again is great news, especially when compared with how many people we were preparing for.
That episode of Burlington Matters will premiere here on your TV tonight at 7:30. We do need to take a break now, but we'll be back with a good news story. Plus, it's National Infertility Awareness Week. More on that still ahead. Stay with us. Welcome back to Halton News. Food for Life has launched a brand new program to help feed our most vulnerable residents. Melissa Candelaria reports.
Food for Life has launched their Good Soup project. The food rescue organization receives large donations of food, and Executive Director Graham Hill says they were trying to figure out ways to turn these large donations into an edible product.
We don't have a kitchen on site, so how do we find someone? And our partners at Nouveau Taste They stepped up. We have an arrangement. We pay for basic services, which helps keep people employed. They use their culinary talents to create a really good soup with the ingredients that we have that are coming in that week. So what it allows us to do is take this wonderful bulk ingredients like large turkeys and large things of chicken, large vegetables, frozen massive things of vegetables, 2,500 pounds of vegetables, and turning it into an edible soup that a senior, somebody who may have accessibility issues, someone who may be hard to house, and somebody who's living in a motel or hotel and has limited kitchen facilities can then have a ready-made meal available for them.
Nouveau Network is a community business center in Burlington. Co-founder Bridget Saunier says they were happy to partner with Food for Life.
So it's certainly part of our ethos at Nouveau. All of our team, we're very community oriented. We're a physical space in Burlington, and we don't think that we can be part of the community without being actively engaged. So that means going out and inviting people in. And so that's really one of our main values at Nouveau is community.
Arthur Zachewski is one of the chefs involved in the project. He says it's the least he can do to give back.
Ultimately, at the end of the day, everyone's trying to get food. I know a lot of people are even around the poverty line. They're dropping down even below the poverty line now too. So even those people that can go to the grocery store, they might not be able to afford to go to the grocery store now. We try to do anything. I mean, even if it's just a couple hundred people, that's a couple hundred more people that get a meal that night.
Hill says programs like their Good Soup project is critical at this time.
If we can nourish our bodies through this, it helps build our resiliency, right? And that's so important right now. And, this next kind of 6 to 18 months, they're all saying is mission critical to us as a society. So how do we do this? We need to be sustainable. So financial donations right now are vitally important. For about $1.33, we produce a liter of that soup that gives somebody 2.5 meals. It's pretty amazing.
For information on how you can help the Good Soup Project, or if you are in need of their services, you can go to the Food for Life website at foodforlife.ca. Reporting for Halton News, I'm Melissa Candelaria.
It's been a rather cold and windy week. Let's take a look now at our 5-day forecast to see what we can expect. Looking into the weekend, we'll be back into those double digits at 12 degrees as our high with a mix of sun and cloud, which will be much nicer than the past few days have been. 60% chance of rain returns though on Sunday and only 8 degrees, but then we'll see sunshine coming back for Monday and Tuesday of next week. In business news, oil continued to bounce back from the historic lows established earlier in the week, and the North American stock markets finished the day in positive territory. Let's take a look. Still ahead, a local Burlington resident shares her experience with infertility. We'll be right back. Thanks for staying with us here on Halton News. It's National Infertility Awareness Week, and according to Fertility Matters, 1 in 6 Canadian couples struggle with infertility. Having had her own personal experience with this, Krista Liochko, a Burlington resident, was willing to share her experience and advice.
There's so many resources out there that you can discover. There's so many different clinics with different options and different ways of doing things. So it's really important to investigate what's good for you. Personally, I've been to 2 or 3 clinics, and I've had different experiences at them all, and there's just different values that I believe help with the fertility journey. One of the things, since we're at New Life here, they believe in doing like acupuncture, your diet, massage, relaxing your body, the deep breathing, counseling, all the things that kind of encompass your whole body to be healthy before you try to get pregnant. That's really important to me and to a lot of people, because that could be the deciding factor. So when you go, it's really important you choose, not just take the first referral that your doctor may give you.
IVF treatments can be extremely expensive, often costing upwards of $10,000. The Ontario government does offer an assistance program, but some couples find they don't have time to wait on the list with thousands of others. This is where New Life Fertility stepped in to offer their same services at a discounted rate of $7,900.
Now that includes the full IVF cycle, which includes ICSI, and or fresh or frozen embryo, and the transfer, and 1 year of freezing costs. Yeah, so it's all one deal, and you don't have to worry about anything. Of course, over and above that, you worry about your medications, but hopefully a lot of companies do cover fertility medication, and hopefully you're one of those people. But it's not even the cost. The cycle we're doing right now is not even the cost of the one round of fertility treatment drugs. Yes. So it's a really great price for it, and we're finding that a lot of couples are saying, I can do that, I can manage that.
For those of you just starting your journey, Krista Liochko, who is also a fertility coach and the founder of Fertility Blooms, offers these words of advice.
Anybody that's just starting out or not sure, just trust your instincts and your gut. I didn't do that for a long time. I listened to a doctor that led me down the wrong path, and it was all about money, and it was all about what she thought was best, and it was totally wrong. And it's made some more challenges in my personal circumstances. So now when anybody's questioning it, I'll always get calls from girls that will say, I've been going to this doctor for like 2 years, but nothing's happening, or I've been going to do this, but it's not working, or I've had this many miscarriages. I'll always say, get a second opinion. And it just seems so crazy. If we were buying a TV, we would go and like check out all the models and whatever, but we just use our same, like whoever our family doctor recommended, that's the fertility clinic we go to. And I really think it's important to get a second opinion and go where you're comfortable, go where they have good success rates, and know their main goal is to help you have a baby, not anything else.
For guidance and support, please visit fertilityblooms.com. For Halton News, I'm Jessica Kading. The City of Burlington invites you to participate in a frontline porch clap every Friday, including tonight at 7 o'clock for our healthcare and frontline workers. Stand outside on your porch or balcony and clap for 2 minutes so that they can hear your gratitude. On the first Friday of every month, the emergency responder vehicles will also show their support, so that's next Friday. You can check out online the route details next Thursday at burlington.ca/coronavirus. We'll be back on Monday with another live edition of Halton News. You can follow us on social media at yourtvhalton.com. For Halton News, I'm Jessica Kading, and I thank you for watching.